More than 100,000 people in Massachusetts are believed to suffer from Alzheimer's disease. And in the next decade, that number is expected to go up by more than 25%. As Connecting Point's Tina Martin tells us, there's no cure, but new legislation is aimed at getting patients and their families better care sooner.
You get crows? Yeah. Okay.
Shirley Coffey is a stickler when it comes to feeding neighborhood birds. She makes her son Michael refill these feeders once a week. It's one of the few things she rarely forgets.
I wake up in the morning and I have to replay what I did the day before so I know what day it is that I'm waking up to.
She first realized something was wrong when she didn't recognize her granddaughter.
This young lady comes in with this cute little 2-year-old and says, "Nana, don't you know who we are?" And it took me a few minutes, and their voices usually make me remember who they are. Oh, we can do that.
This is not the razor-sharp mom Michael Kincaid grew up with, but her symptoms were familiar. He had seen the same ones years earlier in his grandmother. He found his mom a specialist. The diagnosis, Alzheimer's disease.
There wasn't a surprise. We knew something was wrong. And then I realized that I was mourning.
Where did Marie go?
Because he had seen it before, Kincaid knew to get help. But often symptoms are overlooked, not just in families, but also at the doctor's office.
We've often heard the problem in the primary care setting where you'll have someone go in, get diagnosed for a completely different condition. Maybe it's depression. Meanwhile, they're in the early stages of Alzheimer's disease, and they're not having any help in that disease process.
Daniel Zotos with the Alzheimer's Association says the new legislation will require healthcare providers to have specific training diagnosing Alzheimer's and dementia. There's no cure, but an earlier diagnosis means earlier access to medical trials and time to set up a care plan. Another part of the new law will help families like Coffey's.
Black Americans are about twice as likely to be diagnosed with dementia as white populations, and Latino communities are about 1.5 times as likely.
Researcher Jonathan Jackson says it's unclear why the disease is so much more prevalent among these groups, but it may be linked to other health issues.
Black communities or Latino communities have higher rates of hypertension or diabetes, but there are a number of other factors largely attributable to societal and structural barriers that also contribute to higher rates of dementia.
Like what?
One key factor is education.
Increasing education about the disease within communities of color is one of the goals of the new law. Shirley Coffey welcomes anything that offers support as she struggles to hang on to a lifetime of memories.
I can always tell you where I live, I think, but other than that, and my grandchildren and my children, that's it.